If you've ever had that annoying eyelid twitch and you wondered what's that about and is it something I should be concerned with, what can we do to treat it, then this video is for you. Welcome to Eyes on the Road. I'm Dr. Keith Poindexter. The annoying little eyelid twitch that many of us often experience is known as myokymia, kind of a fancy doctor word that's spelled M-Y-O-K-Y-M-I-A. It's a very common complaint that we have with patients in eye care. Basically, it is a lid twitch or a muscle twitch, usually affecting just one eyelid at a time. Most commonly, it affects the lower eyelids. This condition is benign, which means it's not that big a deal, and it's usually self-limited, which means it goes away without us intervening. There are a couple of other different types of myokymia of the face. One of those is called think of hemisphere, hemifacial spasm. That's where more muscles on one side of the face contract simultaneously. And then there's another type of eyelid twitch or spasm called blepharospasm, and that affects all muscles around the eyelid. Blepharospasm patients, typically you'll see them and they will have that kind of response. A hemifacial spasm patient will be kind of just on one side like that. Hemifacial spasm and blepharospasm certainly need further investigation by your eye care provider. But simple lid myokymia is where the muscle that encircles your eye, called the orbicularis oculi, the muscle that when we contract it, it closes our eye. It's when that muscle basically misfires. Again, this can be annoying, but it's not that big of a deal. It certainly doesn't portend any larger issues in most cases. If you want to treat it because it's bugging you for days in a row, then there are several things we can do lifestyle modification-wise that can help. One of those is to reduce stress. Stress has been associated with lid myokymia. The other is to increase our quality of sleep. And then the last thing is to drink or ingest less caffeine or caffeine-related products. If these measures are to no avail and they don't really help, and a patient still desires to have treatment, the next step is an antihistamine eye drop. Antihistamine eye drops are both available over the counter as well as prescription. I tend to prefer the prescription versions because they are a little more powerful. However, if I were going to try one over the counter based off of cost, I would use one known as Alaway. That's A-L-A-W-A-Y, and you can use that twice a day. If these lifestyle modifications and or the topical medication fail to give you relief, the next step in the treatment paradigm is to use Botox. And this is the same Botox you hear about people using for cosmetic procedures. A Botox injection basically paralyzes the offending muscle so that it cannot twitch. However, most people, when they have a choice of twitching on occasion and or a shot in and around their eye, they typically choose to twitch. Anecdotally, for myself, when I have this occur, one of the things that helps to break my myokymia is if I grab the lateral side of my lid and tug tightly to the outside. I just want to reassure you though, in the overwhelming majority of the cases, myokymia is not that big a deal. If you'd like to find out more about eyewear, eye care, eye conditions, different products with the eye care field, feel free to sign on to my channel. I hope this information has been helpful to you, and until next time, remember, when you change the way you look at things, the things you look at change.